Hello, this is Kim Youngjae, Director of a dental hospital in Korea. Now I will explain the standard surgical kit of SLOCK implant. When we perform implant surgery, the implant is important, but the tools for placing the implant are really important. So, I will explain in detail the composition and usage of the surgical kit. When using the surgical kit, it is convenient to open or remove this cover lid. You can separate this and leave it like this, but I will explain it in this situation. The components of the standard surgical kit include a fixture driver used for fixture placement on the upper left side. Standard surgical kit is also called handle kit. The torque screw driver and direction indicator are placed on the right side of the fixture driver. Direction indicator is also called direction pin or depth gauge. And various drills are mainly placed on the bottom left, and in the center there is a ratchet and stopper that are used to insert into the drill. On the right side are auxiliary surgical tools such as hatch reamer and handle. First, let's look at the spiral drill placement. If you look at the standard surgical kit for SLOCK implant, the drill length is fixed at 15 millimeters. The drills are arranged in increasing order, with the diameter increasing as you go to the bottom. And there is a countersink drill right next to it, making it easy to use the step-down technique. In other words, on the left side, 15 millimeter depth drills are arranged in order downward, and there is a countersink drill right next to it. By first removing the cortical bone and then depth drilling, osteotomy can be performed in the correct location and direction while minimizing bone heating. And there is a depth drill stopper right next to the countersink drill, so osteotomy can be performed at the correct depth up to a 3 millimeter diameter drill. At the top of the drill, there is a start drill, side cut drill, and drill extension to assist osteotomy. And next to it, there is a drill knob that can be inserted into the drill. The drill knob can be ratcheted to an extended length by connecting it to the fixture driver used in the handpiece and is used to place the fixture deeply. In other words, it is used to deeply install a fixture for the same purpose as a drill extension used to avoid interference with adjacent teeth. It can also be used for reaming bone tissue by ratcheting by connecting it to a depth drill. Once you understand this drill placement flowchart, you can quickly and easily place the implant in the correct position and direction. And the sequence leading up to the final osteotomy is very clear and easily recognizable, so although this drill configuration is unique, I think you will find it very convenient if you try it. SLOCK Implant's standard surgical kit consists of a left drill system and a right reamer system. In other words, the right reamer system is connected to the handle so that the socket lift can be done easily, quickly, and safely. If the available bone quality is hard, and there is a lot of it, a socket lift can be performed by connecting the drill to the handle. Now let's look at the start drill. Generally, many companies have point drills, or lance drills, and side cut drills, but this standard surgical kit includes a start drill that has all of those functions. When positioning the osteotomy, a drill that also has a side cutting function will be the start drill. So, when you want to place an implant, using the start drill can be very useful for positioning and moving the osteotomy. If you want to modify the start drilling position more easily, it is recommended to use the side cutting drill. In other words, it can be placed where osteotomy was performed and used to correct the shape. In particular, side cut drills are more useful when preparing mandibular anterior implant site. After determining the osteotomy location with start drilling, form the osteotomy depth with a 3.0 mm spiral drill. After performing crestal osteotomy with a 3.7 mm side cut drill, implant site preparation can be completed with a 3.2 mm or 3.5 mm spiral drill. And the 3.7 mm implant fixture can be easily placed using the fixture driver connected to the handle. Spiral drills have a diameter that widens as they go downward, with a diameter of 2.0 millimeters and a diameter of up to 6.0 millimeters. Using this spiral drill has the advantage of excellent cutting power and stable osteotomy. So I think that if you use this drill, you will be able to easily drill even hard bones. Drill systems are marked in yellow and blue. The yellow color marking is for fixtures using a 2.5 mm diameter thorax abutment. That is, it is a drill for osteotomy to install fixtures with diameters of 3.7 millimeters, 4.2 millimeters, and 4.5 millimeters. The drills at blue color marking is used to plant fixtures with diameters of 4.7 millimeters, 5.2 millimeters, 5.7 millimeters, and 6.0 millimeters. Countersink drill is used when the cortical bone of the crestal ridge is hard and thick. In other words, if it is determined that there is available bone with solid bone density after initial bone drilling, step-down osteotomy should be performed. For example, this is a method of initial drilling up to 3 millimeters in diameter at the correct location, direction, and depth, followed by bone removal in the crestal ridge area with a countersink, and then performing a downward osteotomy. In other words, if you first prepared the solid crestal ridge on the upper side and then remove the lower one with a spiral drill, the position and direction of the osteotomy will not change during the drilling process. In most cases of osteotomy, the drilling is pushed from the area where the bone is strong to the area where the bone is weak. So implant site preparation must be performed in the correct location and direction using step-down osteotomy. Another advantage of step-down osteotomy is that it reduces the possibility of bone heating and prevents necrosis of bone tissue. With the crestal ridge already removed, saline irrigation for drill cooling can be easily performed, reducing the possibility of bone destruction. There is a drill extension and a drill knob. This drill extension and drill knob are very useful when drill or fixture driver get caught on adjacent teeth, making osteotomy or fixture placement difficult. When connected, they will increase the overall length and become tools that make it easier to use. In actual clinical practice, anterior implant placement is a problem due to narrow spacing between adjacent teeth. For this reason, the use of drill extension is a very good way to solve the problem of narrow spacing between adjacent teeth. The SLOCK implant's drill extension, which has particularly strong rotational resistance, is a useful tool for anterior implant placement. And if you perform osteotomy using a drill extension, you can check the exact direction of drilling. In addition, accessibility and visibility are increased during the drilling process, allowing implant site preparation to be performed in the correct location and direction. In particular, if drill reaming is performed using a handle, implant site preparation can be performed in the correct position and direction. You can also connect the fixture driver for the handpiece to the handle and install the fixture. Bone expansion occurs if a cone-shaped rotation or side-pushing motion is added during the process of implanting the fixture with the handle. In the end, you can easily install the fixture in the desired direction, position, and depth without using excessive fixture placement torque. This is a fixture driver for the engine. It can be connected to a contra angle like this and used for implant placement. Of course, it can also be used to connect to the handle and plant a fixture. It can also be used for fixture placement by connecting to a drill knob. If you connect it when it is difficult to place the fixture because it is caught on an adjacent tooth, the overall length can be increased and connected to a torque wrench. The below is a fixture driver for a torque wrench, and the fixture driver for the ratchet can be connected to a torque wrench and used for implant placement. Now on the right side of the center of the standard surgical kit, there are reamers for placing implants in the maxillary posterior teeth. Nowadays, maxillary sinus transplantation is performed using a crestal approach, and a hatch reamer is used. This will be a tool made with a really good idea. In the case of maxillary posterior teeth, maxillary sinus bone grafting is often required due to the presence of the maxillary sinus. In particular, a hatch reamer connected to a handle is used to elevate the maxillary sinus membrane by approaching from the crestal ridge of the remaining bone. In other words, connect the hatch reamer to the socket lift handle and lift the maxillary sinus membrane along with the bone tissue of the implant site into the maxillary sinus by tapping. In other words, a socket lift can be performed easily and safely because the remaining bone tissue and maxillary sinus membrane rise into the maxillary sinus at the same time. And a reamer can be used for maxillary sinus bone grafting through the socket-lifted socket. Insert the grafted bone into the implant preparation site and push it up into the maxillary sinus while rotating the reamer. The hatch reamers that can be used at this time are available in various diameters, from 3.0 millimeters to 6.0 millimeters, allowing easy and safe maxillary sinus bone grafting. These tools are always needed these days, and it is much better to have them in a surgical kit than to have them separately. Because it is included in the standard kit of SLOCK implant, it is very convenient to use. At the top right, there are two knobs of 12 mm and 18 mm in diameter for the fixture driver. This is also used a lot. In particular, if a fixture is mechanically placed in available bone with weak bone quality, the bone tissue between fixture threads will be destroyed. This phenomenon is called striping, and it occurs for two reasons. The first occurs during the process of deeply installing the fixture when the drilling depth is insufficient. This phenomenon is called bottom-up. The lower part of the fixture receives resistance from the bone tissue, and the bone tissue between the fixture threads is destroyed during the rotational insertion process. As a result, proper initial fixation cannot be obtained, so a shorter and larger fixture must be placed, or the drilling must be deeper and a fixture with a larger diameter must be placed. The second cause is when the fixture is placed using excessive insertion torque in weak usable bone. If too much force is applied to bones that are naturally weak, the bone tissue will naturally be destroyed. For this reason, it is recommended to connect the knob to the fixture driver and use the feeling of your hand to place the fixture. In other words, a fixture driver knob is used for sensitive fixture placement. And let's look next to the fixture driver. There is a 1.75 mm Torex driver there. This is a driver for handpieces and ratchets. It is 1.75 Torex in size and has a sturdy structure that does not cause deformation up to 100 Newton centimeters. This is very convenient. When we operate the driver inside the mouth, we can stably pick the screw and withstand the load of fixture tightening. The connection area for tightening the actual implant screw must be deep. If it is shallow, it keeps slipping, and it is not easy to connect the screwdriver to the correct position, so you need to dig a deep connection area to make picking easy and safe. SLOCK Implant's Torex driver is designed to make this easy. There are two direction pins on the right side, small diameter, wide diameter. They are basically the same, but there is one unique thing. What it has is a small direction pin with a length of 6 mm that can be used to check the minimum depth after the initial osteotomy. In other words, after initial drilling is about 6 mm, you can check the exact osteotomy depth by inserting a 6 mm long direction pin and taking a radiograph. In particular, it can be used to confirm safe drilling depth in the lower posterior teeth. In other words, it is used for implant placement in the lower posterior teeth with low available bone. It can be used to measure the minimum osteotomy depth to avoid mandibular canal damage. This is a simple process, but it is extremely useful in actual clinical practice. If the exact minimum osteotomy depth can be determined, mandibular neural tube damage can be easily avoided. I thought it would be nice to have something like this while doing clinical work, and I finally put it in this kit. The most important process in implant treatment is fixture placement. The fixture must be placed in the correct position, direction, and appropriate depth. In the end, it is a very important process to check the location, direction, and depth of the initial osteotomy using a direction pin. And the SLOCK implant comes with a healing plug as standard, so you can easily check the fixture placement location and direction. In other words, implant site preparation is performed by determining the location, direction, and depth of the osteotomy using a direction pin. And you can use the healing plug to check the location, direction, and depth of the implanted fixture. Healing plugs are very important. The healing plug is truly an indicator of the implant position and path. Especially now, it is essential to determine the correct position and direction when placing multiple implants. When placing a fixture, if you have the patient occlude, you can easily check the relative positional relationship with the upper and lower remaining teeth or implant. The same applies to single implant placement. For example, when placing an implant in the mandibular second molar area, even if the pass is slightly wrong, mechanical complications are likely to occur later, so it is necessary to check for such things by inserting a healing plug into the fixture. The healing plug of the SLOCK implant is designed to be simple. A particularly important point is this area with the two bands shown here. The meaning of this area is 1 mm at the bottom and 2 millimeters at the top of the fixture. When placing implants these days, it is recommended to place a subcrestal of at least 1 millimeter. When looking at soft tissue, a depth of 4 millimeters to 5 millimeters is recommended, and the border with the upper part of the healing plug can serve as a reference line. It is very simple and clearly distinguishable, and if necessary, the depth of fixture placement must be adjusted. It will be a very useful part, especially when installing fixtures using the flapless technique. So far, we have learned about the standard kit of SLOCK implant. There are many tools for placing implants, but I think the tools in the SLOCK implant standard kit are easy to use and well made, and I am confident that we will help you have the most comfortable implant surgery. Anyway, I hope this will help you perform implant surgery comfortably and easily. Thank you.